You wouldn't know it from the outside, but this unassuming building in Downey is a hotbed of disease and contagion. From hepatitis A to syphilis and typhus, this is where threats to the public's health come in by the thousands each month for testing and evaluation.
The public health laboratory tests patient specimens, environmental specimens, and food specimens of public health importance. We receive specimens all throughout Los Angeles County from our public health patient clinics, from the county hospitals, and from community-based providers.
It's state-of-the-art science in a high-stakes battle to keep emerging threats at bay. Public response to recent outbreaks of typhus, hepatitis A, the rise in syphilis cases, and others start here.
So we often have outbreaks or outbreak investigations, and the lab is critical in terms of us having confirmation of whether or not there actually is disease present, and being very timely in that. So the lab really does serve a critical purpose in terms of giving us information on which to protect the public's health and well-being.
This lab receives several thousand specimens a week and conducts more than 500,000 tests every year. It provides a vital snapshot for the overall health of LA County.
Public health is driven on data and confirmation of tests in terms of understanding what we're actually dealing with. So people can have very general symptoms like flu-like symptoms, but we don't know exactly what they have until we do lab tests to confirm that. And once we know what they have, then it tells us what we need to do in order to protect both them and the people around them.
At the Public Health Laboratory, courier systems will bring specimens in throughout different hospitals, doctors' clinics, to the Public Health Laboratory 24/7. We're here waiting for those samples, able to test them at a moment's notice.
One of those is lab assistant Abraham Jimenez. For him and for the 130 staff members on the front lines of protecting the public health, matters of life and death are just another day at the office.
Aside from receiving, from monitoring certain outbreaks, things from measles, Zika, things like that, so that way we can just monitor and see where, if there is an outbreak, how far and wide it's reaching. And then just certain small things, even with like influenza, with gonorrhea, syphilis, just so we can keep a tab on how everything's going, and then just inform the public if there is something that they need to be concerned with.
In Downey, I'm Joe McDonald.